Whenever we want to assess the impact of a new subvariant or variant of concern, we want to know how transmissible is it, how well is it able to evade prior immunity, and also what degree of severe disease does it cause. According to the WHO, the BA.5 subvariant is now the dominant strain globally. And in terms of transmissibility, it is the most transmissible of all the versions of the SARS-CoV-2 virus that we've seen so far. And it is also the most adept at evading immunity built up by prior vaccinations and also from prior infections. In terms of the severity of BA.5, however, it is a bit of a mixed picture. If we look at what happened in Portugal and also in South Africa, and these are two countries that experienced their fifth and sixth COVID waves, we saw that there was definitely an increase in cases, but in terms of the number of new COVID deaths, either the same or similar to previous waves or even lower. However, if we look at data from the UK, it shows a different picture. They are experiencing a huge surge in both new cases, but also an increase in hospitalizations and deaths. In terms of protection of the vaccines, we're talking about different things: protection against infection, protection against severe disease and death, and then protection against onward transmission once a person is infected. As long as you stay up to date on your vaccinations, it does seem that our vaccinations are holding up in terms of protecting against severe disease and death. Although I will say in South Korea, over the last 3 months, there has been a decay noticed in terms of protection against severe disease and death due from the third dose of a COVID-19 vaccine. It went down from 92% protection down to 83% protection. So we are seeing a decline in protection. That is why we need to stay up to date on our boosters.